Personality disorders are characteristic ways of thinking and responding that develop over time, and they occur in multiple settings. So it doesn't occur just at work or just at home. They become ways of relating and ways of understanding the self and the world that are usually formed in response to life events, especially that develop early in childhood. And they become ways the person learns to navigate either confusing parts of the world or things that they don't really understand in terms of interactions with others, especially with adults, early childhood relationships, that then carry over as ways of coping that while perhaps in childhood they may have been adaptive, they become characteristic ways of relating to the world that lose that ability to be effective. And so what often happens, the person doesn't think that there's anything wrong. They just think that they're getting by in the world, like everyone's trying to get by in the world, yet they're having trouble in relationships, they're having trouble at work, they're having trouble feeling close to people, they're having trouble getting their needs met in an appropriate way. Really having a specialized team that the retreat has, for example, that understands the complexities of personality structure, understands the dynamics that influence how personality is developed, and also how it can change, really is critical in a multidisciplinary, intensive approach, because you can't work on just one piece of it at a time. There's a lot of stigma surrounding personality disorders. Oftentimes, others sort of respond to the person who has personality disorder as if they're bad or wrong, or as if it's a moral injury, or they're doing something to be difficult. Meanwhile, they're really trying to adapt and trying to survive in a world that probably doesn't feel comfortable to them. It isn't just multidisciplinary, where you have separate disciplines, if you will, evaluating and treating the patient. It's interdisciplinary. All of those disciplines and all of the gifts and ways of knowing that they bring to that situation with a particular patient at that point in time really integrates the treatment approach, which also then helps the patient integrate their treatment and integrate it into their own sense of self and their own patterns of relating. And those disciplines span from psychology to psychiatry to art therapy to yoga to dialectical behavior therapy and transference-focused psychotherapy, which are evidence-based treatments for personality disorders. While there are different types of personality disorders, understanding the fundamentals of how personality disorders develop, the factors that maintain them, and the factors that help people to change and maintain those changes is the critical difference. There's so much potential of having the person really come to their own sense of self at this point in time, wherever that is, and we take patients right where they are at that point in time, and really help them to author for themselves, and we help them to co-create really what might come for them in the future.